Here is why some people prepare so hard for the nursing council exams, but they still fail. I once belonged to that category. I studied so hard, I watched so many videos on YouTube, but I failed my nursing council exam at my first trial. Now, nursing council exam was not designed for you to fail, but rather it was designed for you to pass. But there are so many students like myself that sat for that exams and did not pass. And the reason is that they made at least one of these mistakes I'm going to be sharing with you in this video. So if you're sitting for the nursing council exam, you want to watch this video so that you will know these mistakes and avoid them so that you pass your nursing council exam. Remember, the council exam was designed to make you to pass and not to fail. So let's dive into the reasons that make some people to fail the nursing council exams. The first reason here is the fear of failure. Now, there is this popular adage that says the fear of failure is the beginning of failure itself. Now, if you're a nursing student, you agree with me that as the nursing council exam approaches, there will be so many hearsays about the nursing council exams. So many people will say paper two is more difficult than paper one, and it consists of advanced med surg, consists of maternal and child health. You also find mental health management and all these tough courses. So it's going to put in fear into your body. And others will say if you fail paper three, which is the OSCE, you will have to rewrite paper one, two, and three, regardless of if you scored 99% in papers one and two. So when students digest all this information, it's going to cause fear in them. And now, here is what happens when you are afraid. If you enter the exam with so much fear in you, this is what's going to happen. You will lose your critical thinking ability. So instead of thinking critically to produce answers to your question, you become confused and carried away. And by the end of the day, you find yourself scoring 49 in that exam. And our pass mark in nursing is 50. So here is my key takeaway for you. If you're sitting for any exam, I would advise you to remove fear and anxiety. Stay confident, because the more confident you are, the higher the tendency of your brain bringing out the best information during that exam. So next time you have an exam, I advise you to stay confident. Do not fear. You got this. The second reason why people fail the nursing council exam is burnout and fatigue. You will agree with me that nurses go here and there preaching to people that they need to take frequent breaks, but we ourselves find it difficult to take breaks. Now, so many students study so hard that it leads to burnout. And what happens when you are burnt out? You get confused and you will not have enough energy to sit for the exam. And what happens? You begin to have low scores. See, let me tell you, resting prepares your mind for the exam. It helps you to stay focused and alert. So don't be like my friend that was studying up to 3 a.m. on his exam day. This is what I want you to do if you have an exam to take. A day to your exam, I want you to do away with your books. I don't want you to study. Do not study anything, because you've been preparing for this nursing council exam since the first day in nursing school. So if you don't study a day to exam, it doesn't mean that you're going to fail. So I want you to put your books away. A day to exam, I need you to go out, take a walk. You can go and get something for yourself to celebrate your success in anticipation. You could also offer a prayer of thanksgiving, because I assure you, you're going to pass that exam. And what this does for you is that it helps to keep you energetic. It also helps to keep you organized for the exam. So you don't enter the exam being disorganized. Because if you are disorganized in an exam, I tell you, there's a high risk that you fail that exam. Now, the third mistake so many students make that lead to failure in the nursing council exam is poor time management. Students spend so much time on questions that they cannot answer, thereby leaving little or no time for other questions. And what happens if you make this mistake? You find out that you will be rushing at the 11th hour. And when this happens, you find out that you will be making mistakes that are preventable. And by the end of the day, you fail the exam. So here is what I want you to do to manage your time. Remember, you have 250 questions to answer in 3 hours. That 3 hours for me is more than enough for you to answer your 250 questions if you follow my strategy. Now, here's what I want you to do. Once you enter the hall and start taking your exam, you read the question and the options. If you've read it once and you can't provide an answer, read it for the second time. If you can't provide the answer, please don't go reading it for the third time. skip that question and come back to it later. If you go to the next question also and you don't have the answer, please continue skipping until you find the one you can answer. And when you've gone through question 1 to question 250, you can now come back and start reviewing those questions that you could not answer. And if you find out you can't answer them again, you go over to the next question. And by the end of the day, you find out that that question that you skipped initially was actually the easiest question, but because your brain was not ready to provide the answer for you at that time, you could not answer it. So why wasting time on that question? Let's go over to the fourth mistake so many students make and they end up failing their exams. And the fourth mistake we have here is misinterpreting the questions. See, let me tell you, wrong interpretation of the question prompts your brain to provide a wrong answer that seems correct. And you know the most crazy part of it is that this wrong answer always appears among the options. So when you've misinterpreted the question and you've provided a wrong answer, your brain will tell you, oh, this answer is correct. So you click it. And by the end of the day, you find yourself scoring 49. Okay, let's look at this question. It says, paracetamol is not an NSAID. True or false? Now, because we are rushing and probably you've misinterpreted this question, you would read paracetamol is an NSAID. True or false? Now, because you've omitted that not in that sentence, the right answer to you there now is false. But when you interpret the question correctly and bring back that not, you find out that the correct answer there is true. So these people find a way to twist these questions. So if you are not properly guided, you are likely to fail. Now let me relate this with OSCE. When I was taking my exam, I walked into the hall and then I saw a model there. I also saw a signal manometer. And then I rushed to greet my examiner. Good morning, ma. I'm exam number 214 and I'm here to check my patient's blood pressure. Quickly, I carried the signal manometer placed on the patient's arm, bam, and I checked the blood pressure. And by the end of the day, I got my readings and documented. So when I realized that I still had more time and my examiner was looking at me, this is what I did. I went back to look at the instructions again, and then I realized that I had done the wrong thing. But I did not panic. Here's what I did. I tried to understand the question first, and after understanding the instruction, I looked my examiner in the eye and say, "Ma, remember that I was told to check this patient's vital signs." Now, I did not seek, and I did not explain the procedure to my patient. I did not obtain consent. I did not perform hand hygiene. I also did not provide privacy. I did not wear my gloves. So instead of panicking, here's what I did. I had to go back to those things I did not do initially. And I was like, Ma, remember that before I started this procedure, I greeted my patient, explained the procedure to her, and obtained consent. And after obtaining consent, I brought my supplies and then I performed hand hygiene. I wore my gloves and then I started my procedure. Now, remember that if now I did not say these things when I started my procedure, neither did I demonstrate them. But because I have said these things, the examiner will go back to her checklist and begin to tick for me. Now, if I had continued with my procedure without saying these things, the woman will also continue marking me without marking the preliminary part of the procedure. Next time you're in the hall for OSCE, please ignore the examiner. Don't be that student that rushes to greet the examiner. Please stand one side and understand the instructions first before you can now start saying good morning. Then you talk about the preliminary things you will do before you start any procedure on a patient. Then you start your procedure. And after doing your procedure, you thank the patient, make him comfortable, and discard your supplies. That is how to do OSCE. Because in OSCE, they are not trying to know if you can do the procedure or not. They are trying to know how safely you can perform this procedure using real patients. So even if you have a dummy there, make sure that you obtain consent. Treat that dummy as a real human being. And you score nothing less than 90 in your OSCE. Now, the fifth mistake that makes so many students to fail their nursing council exam is using the wrong strategy. And you ask me how. Now, it's a month to nursing council exam. And somebody is still struggling with burnout and Standard Med Search textbook. Don't get this twisted. I'm not trying to tell you that Bronner's Med Search is a bad textbook. In fact, it's the best made such textbook I've ever come across. But at this point, you have limited time, so that big textbook is not going to help you. So what I need you to do is passive studying. So what you should do is try laying your hands on NMCM practice questions. So here is what the NMCM practice question is going to do for you. It prepares your mind for the task ahead, and it also exposes areas that you need to study. So now, while I was preparing for my nursing council exam, I was using the nursing school curriculum. So when I look at the curriculum, I'll be like, oh, under med-surg, I've covered the disease of the digestive system, and I know the pathophysiology. I know how to manage them. I can draw the nursing care plan, so I'm good to go. So I stopped reading. So along the line, I came across a practice questions on um, the respiratory system, and it's dawned on me that I did not know what underwater seal drainage was. So here's what I did. As I was practicing those NFCN style questions, when I come across any topic that I need to revisit, I'll write it down. And by the end of the day, I'll go back and study that topic. It helped me in my nursing council exam because that underwater seal drainage came out in my exam. So if I had not gone back to study it, maybe I won't have been able to provide an answer to that question. So here is a key takeaway for you. You have to practice at least 200 questions in a day. And by the end of the day, you take note of the rationales behind those questions. And then write down those areas that you need to study again. And at your leisure, you go back and study those topics. Some people were asking me what I use for passive studying. I'll be listing them out for you. Initially, I was using hard copy practice questions. I found out that I was too lazy to mark them. So what I did was to go online and start doing CBT questions. Now, here are some websites I use for my passive studying. The first one is the Academic Nightingale on WhatsApp. See, I used the free version because I did not have enough money to subscribe for their practice questions. So each time there is a free question, I click on the link and to take me to Google Forms where I answer the questions and then I review the rationales. Then I also use Nursing CBT Solutions. Is an online platform where you subscribe and then you have access to study materials and practice questions. See, the beauty of this Nursing CBT solution is that it is like a normal nursing council CBT. It is timed and it gives you the rationales behind the questions. So you have so you are at liberty to choose any specialty of nursing that you want. If you want general nursing, if you want midwifery, if you want accident and emergency nursing, they are all there on that platform. So I advise you to go to that platform. It's not expensive, you can afford it. I also heard of the Abdullah app. So many nurses have been talking about this Abdullah app on TikTok, but then currently I have not used the Abdullah app before, so I don't know what is inside. But then so many nurses have left their reviews on the Abdullah app, so I would advise you to download this app on your phone. It's on Play Store. You can also get it on Apple Store if you use an iOS device. And after this video, I also download the Abdullah app for myself so that I can use it for my further exams. Remember, the council exam was not designed for you to fail, but rather it was designed for you to pass. So hard work plus the right strategy gets you the medal. I'll see you on the next one. Let me know in the comment section if there's any other topic in nursing you want me to talk about. And do not forget to subscribe to this channel so that you will not miss out on my subsequent uploads. I'll see you on the next one.